episode 62 of the Real World Wellness Podcast. Hi everyone, I'm Christine Lehmann, a nutritional therapy practitioner and reverse diabetes coach, which is also the name of my website. I help clients reverse diabetes naturally, lose weight, and lower their cholesterol, and I also see clients by Skype. You can buy some great paleo and primal products on my podcast page, such as Primal Life Organics and grass-fed meat. I switched to Primal Life, which is completely natural organic skincare this year after interviewing Primal Life CEO and nurse Trina Felber here on the podcast about some common chemicals found in many skincare and hair products. I love her Primal Life face wash and other products, which you can check out on my podcast page at reversediabetescoach.com. Please remember while you're listening to the show, advice and information we provide is intended to be helpful and informative, but is not a substitute for medical advice or treatment. So I'm really delighted to have Amy Berger back on the show, and Amy is a certified nutrition specialist and NTP and a regular co-host, and I've also interviewed Amy about ketogenic diets and Alzheimer's and the connection with insulin resistance. And so today we're going to have a little bit of a switch. Amy's actually going to interview me about all things diabetes, pretty much all things, whatever we can cover. So welcome, Amy.
Hi, hello, glad to be here as always. So Christine, I think you're kind of doing some rebranding right now, but you have in the past, called yourself the reverse diabetes coach. So obviously you are pretty well educated on, like you said, all things diabetes. So tell people about the common trajectory for type 2 diabetes. I mean, how does this come about, and what happens to somebody that gets type 2 diabetes?
Right. Well, that's a great question. As you know, Amy, it often starts with metabolic syndrome. And, insulin plays an important role in that as well. And just to refresh people's memory, insulin is an important hormone in blood sugar regulation, and along with glucagon, and these two hormones really work in tandem to regulate blood sugar. So when people eat food or meals, their blood sugar tends to rise, and then insulin kicks in, and that helps control it and bring it back down to, in a healthy person, what is considered a normal range. So in metabolic syndrome, often insulin is starting to decrease, and it may become more resistant. There's often weight gain. One of the markers for that is abdominal fat, and that it doesn't mean that you're necessarily really overweight. You can even be just 10 pounds overweight, but that fat is centered around your abdomen. It can wrap around your organs, and it's called visceral fat. And that can be a risk factor for heart disease later on, and certainly for diabetes as well. So that's an important reason why you want to get a physical, why your doctor should be looking at that. And frankly, you may, need to lose even, that fat, that in particular that visceral fat, because that is a risk factor for diabetes. And then there's this progression. So from metabolic syndrome, it can also lead to prediabetes, which used to be called borderline diabetes. And this category is gaining more attention as more doctors are screening for it, which I think is really helpful, because the whole idea here is prevention. If you can catch it early, ideally even back up, to metabolic syndrome, but you catch it early, you can prevent the onset of type 2 diabetes. And an estimated 60 million Americans now have prediabetes, although many of those may be undiagnosed. And that is characterized by having above normal blood sugar. But also insulin resistance can start at this phase. And as you know, Amy, we've talked about the importance of getting tested as well.
Right, and I want to emphasize for people, because this is such a I wouldn't say it's a pet peeve. It's a favorite issue of mine. Is that at this stage of the progression of this condition, your blood glucose could actually be normal, but your blood glucose is normal because it's being kept in check by the high insulin. So you could be insulin resistant or hyperinsulinemic, which is just a fancy word for saying excessively high levels of insulin in the blood. You could have that even though your actual blood glucose is still normal.
Right, exactly. And that is very important. So it can precede, as you were pointing out, this rise in blood sugar, which is also that borderline diabetes phase. And so that's also a marker, certainly, and really where you want to try and catch things, because then you have a much better chance of preventing the onset of type 2 diabetes.
Absolutely, yeah.
And I've been fortunate enough to have a few clients who are proactive, who saw that it ran in their family, which is not always, that's one risk factor. But, we're understandably very concerned and wanted to prevent it. And we were able to, working together, we'll talk about strategies and the pillars of my program, but working together, really getting the diet, the exercise, stress management down, they were able to prevent it. And it is a lifelong lifestyle and patterns that you want to establish so that you can prevent it the rest of your life, not just for the next year, but really for the next several years. So as I was saying, about 30 million Americans actually have type 2 diabetes, and that by the time you have type 2 diabetes, you do have insulin resistance, and you have the higher than even, the blood sugar levels are higher than pre-diabetes, and we'll talk about, the range in a minute. But also depending on how long you've had that condition and how well controlled it is, because that's another issue. There are plenty of people with uncontrolled diabetes. You may experience, medical complications.
Right, definitely. I mean, there's so many terrible things associated with long-term poor control. So, what are some of the more serious or serious and not so serious complications of type 2?
Right. Well, that's really a good question, because diabetes type 2 can impact every organ and every system of your body. And people with type 2 diabetes are significantly increased risk of nerve damage called neuropathy, kidney disease that can lead to dialysis and shutting down and deterioration, liver disease, diabetic retinopathy, cataracts and glaucoma, heart disease, and stroke. So it's very serious. And sort of the tricky thing with diabetes is it's often been called the invisible disease, because sometimes it kind of sneaks up on people. They really don't know they have it, and often they don't know because they're frankly not being seen by a doctor. They're not getting on a regular basis. They're not, for example, getting their annual physical. So I can't stress how important that is to go for your annual exam. And
right. I feel like that's how people can catch it in the early stage. Like we said earlier, they can see if their fasting glucose is on the rise or their A1C is on the rise, or even insulin. You can get your fasting insulin levels tested. You typically have to request it. It's not usually included with a normal blood test like the glucose is, but they can definitely do it. But yeah, you usually have to request it. It's not a standard test. It should be, and I think at some point in the not too distant future it probably will be, as the medical community starts to recognize how enormous a problem insulin resistance is. But for now, you do have to ask for
it.
So, Christine, for the people that are maybe not going to the doctor as often as they probably should, what are some of the common signs and symptoms that they can look out for that might tip them off to the fact that something is brewing?
Right. So before I get to that, I just wanted to elaborate a little bit more on the medical complications, and that's a great question about the signs. But neuropathy or nerve damage is a common complication of type 2 diabetes in about half of the people. So that's 50% right there. And then I just wanted to share a story that really struck me when I was at the University of Minnesota getting my master's degree in public health and journalism. I spent a lot of time with Native Americans. They have about 16% of the Native American population is in Minnesota, and they have among the highest type 2 diabetes rates of any population. And I was really struck by this man who was a carpenter, and he was working on someone's roof when his legs literally gave out and he fell and then had to be taken to the emergency room. And there they diagnosed him with type 2 diabetes, but the nerve damage had progressed to the point that he could no longer keep working as a carpenter.
Wow.
So, yeah, it was really...
And he probably had many other signs and symptoms and just didn't know to put them together. He didn't know that those were signs of something insidious. You know, I mean, I can't imagine that moment of his legs giving out was the first time he'd ever had, like, numbness or tingling or something in the extremity, you know?
Exactly. He may have had frequent urination, thirst, fatigue. You might have even had a slight numbing sensation, but in his hands and feet, but he, you know, like a lot of people, you just tend to shrug it off, or it's no big deal. Even blurred vision or fatigue or irritability, which are associated with other conditions, you know, you may not realize that's related to type 2 diabetes. Even unexpected weight loss can be related. So the other medical complications, again, which are very serious, are your risk of glaucoma is 40% higher, risk of cataracts is 60% higher. The longer you have diabetes, the greater the risk.
Yeah, I think if I'm not wrong, except for malnutrition and vitamin A deficiency, like in the developing world, type 2 diabetes is the #1 cause of blindness worldwide.
Mm-hmm. Yep,
that's crazy.
It is. It really is. And then another issue that people don't often associate with type 2 diabetes is oral health problems. I actually had a dentist, you know, write a guest blog for me, but some of those conditions that you might be more likely to suffer from are tooth decay, periodontal, which is gum disease, fungal infections, salivary gland dysfunction, cuts in the gum that take longer to heal. And then also, you also are more prone to urinary tract infections. So it's not a pretty picture. And again, the more likely you are to prevent these complications is getting diagnosed early and making the necessary lifestyle changes.
Right. So we kind of ran through a lot of the signs and symptoms just then. Does type 2 diabetes run in families? Because, you know, people are like, oh, well, you know, of course I'm diabetic. My mom was diabetic. My aunt was diabetic. You know, this is just the way our family is. Is that true, that it's a genetic issue, or does it run in families?
Well, yeah, let me address that, because there are risk factors that would lead you to think that, and then I'll answer that as well. So some of the risk factors for diabetes include having a sibling or a parent with the condition, diabetes during pregnancy, which is called gestational diabetes, being overweight or obese, older age, I would put it middle age and up, and lack of exercise or activity. So, and other conditions such as metabolic conditions like polycystic ovarian syndrome also increases your risk. So as far as diabetes running in families, as I was alluding to, having a sibling or parent with diabetes, I think there is a small genetic component, but I think it does have to do more with families sharing a common diet and lifestyle. So when you think about, you know, the kind of food and patterns that go on in families, you know, it's if the diet involves a lot of fried food or processed food with a lot of sugar, if they're eating a lot of sweets, you know, the children are growing up in a family where most likely they're sharing meals together, and the mom's doing the cooking. That's in a traditional home, but then they typically even will continue a similar diet when they leave home. For example, they tend to replicate favorite foods. I know I would make, you may laugh, but this dish called chicken de marvelous, which was baked chicken with Campbell's soup, mushroom soup on white rice, because it was like comfort food. And so even when I moved out of the home, went off to college, and then had my own place, I was starting to do some cooking. I would take some of my favorite recipes that I grew up with and cook them. So I think we have a tendency to replicate often the kind of diet that we grew up with, if not at least some of our favorite foods. So I think it has more to do with that, and also the fact that if your parents aren't, or even your siblings really aren't exercising much, you're not being exposed to sports, or you don't play sports, you may be in a family that's more sedentary, I think that can also, be another factor. So I tend to think it has more to do with lifestyle and diet that you grew up in, as opposed to necessarily a biological genetic component.
Yeah, I completely agree. I think it's a lot of that we put down to being hereditary or being, quote unquote, in the family is environmental. It is, the diet that you grow up eating and the foods that you're used to. But I also think, like you said, there may be some genetic component that we cannot influence, that has nothing to do with what we eat or how we exercise. But I think, I've said the same thing about Alzheimer's. We can say the same thing about many other conditions. Any condition that may have a genetic component, it's not so much that any of these particular genes literally program us to develop an illness or a condition like type 2 diabetes or Alzheimer's. It's more that particular genotype makes us more susceptible to, adverse metabolic changes in the context of the diet and lifestyle that we choose. So somebody may have an increased susceptibility for metabolic syndrome or type 2 diabetes, but if they, avoid the high carbohydrates, if they avoid some of the other foods that may provoke an insulin response, a high insulin response, then we just don't tempt fate. I don't think it's not a given. Yeah, it's you can manage. You mitigate the risk via your diet and lifestyle. You have an increased susceptibility, but that doesn't mean that you're inevitably going to develop a condition. You just have to be more careful about how you live.
I think that's so true, and I think if you have a parent, with type 2, and you're seeing that they can control it as well, or reverse it, I think that's also encouraging. At the same time, if you have a parent where it does tend to run in your family, it is good to make you more vigilant and to certainly get tested and find out if you have it, and then also to start working on it.
Right. What are some of the tests that are used to diagnose type 2 diabetes, and what is the diagnostic criteria? Like what how does somebody have to look in terms of their metabolic numbers in order to be diagnosed with type 2?
Mm-hmm. Well, let's start with some of the tests, and then we'll talk about the ranges, some of the numerical ranges. So, because the tests are the same pretty much for prediabetes and type 2. So that's the hemoglobin A1C. We'll start there. That measures the average amount of sugar coating on your red blood cells for the past 2 to 3 months. So I kind of like that one because it gives you, I think, a longer period of time to evaluate, even though it's an average. And the other plus is you don't have to fast for that one. So it's very convenient. A lot of people often forget to fast and so on, so they can at least do that one. Then there is the fasting blood glucose, which, as the name implies, you have to fast usually the night before, but at least 12 hours beforehand. And that I view as sort of a snapshot of how your blood sugar is that particular day and time. So a good a diagnosis would be to confirm both tests, to have both tests done and see that they confirm your diagnosis, whether it's prediabetes or type 2 diabetes. Using both tests is a good idea, and then there's also the oral glucose tolerance test that can be used to test gestational diabetes. But that one, if the doctor doesn't think you need it for that purpose, I don't recommend, because that one involves drinking, I believe, a very sweet liquid, and it's pretty unpleasant, and it takes longer. So that one I don't think is necessary unless the doctor suspects something else or gestational diabetes. So that's the test. And then as far as the criteria, what a doctor will do is look at basically a chart and determine where you fall on this range. So the normal range is below, on the A1C, is below 5.6. The fasting blood glucose, it would be 99 and below. So that's the cutoff, is basically 100. Determines 100 and above would be pre-diabetes and then type 2 diabetes on the fasting blood glucose. So, for example, it would be 100 to 126 on the fasting blood glucose. On the A1C, it would be 5.7 to 6.4. And then anything that is 6.5 and above is considered type 2 diabetes on your A1C, and 126 and above is on the fasting blood glucose. So
I've heard some people, and I kind of agree, I've heard people say that pre-diabetes should really be changed to be called stage 1 diabetes, because that would really make people take it much more seriously. Like, oh, it's just pre-diabetes, because, normally the doctor will say, just watch and wait, be careful about what you eat. But I don't think people, some people will really have a wake-up call at that point, but some won't,
Absolutely. I would love that kind of rewording, because I think you need to get people's attention. What I really emphasize again is avoiding that progression that we've been talking about, as well as the medical complications, because you can experience medical complications even within a year of having type 2 diabetes. And also, you don't know, if you wait until you're diagnosed, you don't even know for sure how long you've had it. So timing is very important, and the longer it goes on, frankly, the worse it gets. It doesn't get better on its own. That's a myth.
Yeah, no, it's and as they say, an ounce of prevention is worth a pound of cure. It's really easier to stop this from happening in the first place than it is to reverse it once it's already there.
Exactly.
So are there any other tests? Are there other tests that you would recommend people get besides those glucose measurements?
Yes. I usually like to recommend that they get their insulin tested, as we've talked about, and also their inflammation level, because the research shows that most people with diabetes have low-grade inflammation. And then also to look at their cholesterol. So it is common when my clients come to me, I require them to bring their lab results, recent ones, and that I will check their cholesterol numbers, so it's not unusual for them to have low HDL, which is called the good cholesterol, and high LDL, or the quote-unquote bad cholesterol. So we always want to work on that, as well as having often high triglycerides. Another test that I may ask for, I usually check their thyroid levels, but depending, if they haven't had a thyroid hormone test, I will, especially if they're overweight or obese, I want to look at that as well. That could be due to hypothyroidism. And then,
and the high cholesterol count as well. That's actually a symptom of low thyroid, is elevated total cholesterol and LDL. And I did want to mention, just to not confuse anyone out there, some people who follow low carbohydrate diets, whether to manage type 2 diabetes or not, will see their cholesterol rise, including the LDL, and that's not necessarily a bad thing. We said sort of quote-unquote good and bad cholesterol, because there's a lot of misinformation about these two particles, the high density and low density lipoproteins, and it's not automatically a bad thing or a bad sign if LDL rises. If your HDL is also rising and that ratio stays in a good place and your triglycerides are dropping, there's a lot of data coming out now that the LDL really is not that big an issue. And Thomas Batesburn, one of the country's foremost lipidologists, has said that LDL, not total cholesterol, just LDL, is not a risk factor for anything until it's above 200. And again, that's not total cholesterol, that's just LDL. So I just don't want any listeners to be afraid if they see their cholesterol rise or if they have high cholesterol. It's not necessarily a terrible thing. And so much more data coming out now about the dangers of statins, and that with older age in particular, higher cholesterol is absolutely protective. There is an inverse relationship between cholesterol and LDL and all-cause mortality. And in plain English for the listeners, that just means that the higher your cholesterol, basically the more robust your body is, the less your risk of all-cause mortality.
Right, and I'm glad...
I'm not saying there's no limit, like, if your cholesterol is 400, yeah, there's probably something going on there, but, it's just not what we think it is, so I don't want people to become too afraid of quote-unquote high cholesterol.
Right, well, I'm glad you're bringing that up, because I have had my total cholesterol be a bit on the high side, but it was because my HDL was so good. My HDL really, as my diet and lifestyle change went up, and the LDL went down a little bit, but the HDL really went up significantly, and so that's what the increase is due to. So I think it's important to also look at all the numbers and understand that your total cholesterol can go up if one of those, due to your good HDL going up as well. So not to be overly...
Even if the LDL goes up, this is what I just have to emphasize, that LDL really isn't the bad cholesterol. I think that's hopefully something that will change soon, too, with some of this nomenclature. It's that good and bad cholesterol just...
Yeah, that's a real simple...
But it's just, but it's exactly... Look, it's what you said is exactly right. You can't really tell anything by just your total cholesterol. You have to look at the total picture, and when it comes to type 2 diabetes, especially looking at the HDL and the triglycerides and everything else in conjunction with the insulin and the glucose and the A1C. So.
Exactly. And then the other thing I like to look at is any nutrient deficiencies, because it is common for people with type 2 diabetes to be nutritionally deficient in vitamin D, and also depending on whether they've been on a kind of low protein, meaning animal protein diet, for example, they may be vegetarian or pescatarian. I might also want to get them tested for like B6 and B12, or B complex.
Yeah, and so many type 2 diabetics are magnesium deficient and also chromium deficient.
Yes, and we'll be talking a little bit.
It's no surprise, because both of those minerals are required for proper glucose metabolism.
Exactly. So, we'll talk more about supplements and some foods with chromium and so on, because that is very important to help regulate your blood sugar as well.
Yeah. Do you ever look at liver enzymes, or ALT, AST, anything like that, or just more so the insulin and other metabolic factors?
I tend to look more at the other metabolic factors, but I do have them get a complete pretty complete panel for their lab tests. So I always pay attention to other factors, even the creatinine bun ratio and other things, to make sure it's in the normal range.
Yeah. Okay. Because most of those, are, if anything's out of whack, it's really more likely an effect of disturbed metabolism rather than the cause. Like if someone has type 2, those things will result. It's not that those things are causing the type 2.
Exactly.
Yeah. So once somebody is diagnosed via maybe some of these tests, what do they do? What steps does somebody take when they have this wake up call all of a sudden?
Mm-hmm. Well, it's really important to start thinking about how and what lifestyle changes can you make. And all the research shows that nutrition and exercise, or what I now call movement, really can have a dramatic impact. I mean, I've seen it in my own work with clients, and we'll talk about some case studies a little bit later. I wouldn't call myself the reverse diabetes coach if I didn't think it was reversible. Now, everybody starts from a different point. So obviously if you have pre-diabetes, it's easier. It'll take a shorter amount of time to reverse than somebody with type 2. And even there's a spectrum, just which we'll talk about. I'll give you some cases to illustrate that. So, but I think it's important to recognize that it is, as we were talking, it is something that can be treated and reversed and controlled. So you want to find ideally I think, a holistic practitioner, because that person will look at your physical, emotional, and mental health, and possibly even spiritual health. It is important to seek out someone with some credentials. I think a nutritionist is a good place to start because they will be focusing primarily on diet, but a holistic nutritionist will also focus on movement and stress management and these other aspects of your life that all feed into either the reasons you got to this place and or where you're at, so these components that are necessary to help reverse it. So that is why I also want to just briefly mention the 4 pillars in my program are diet, movement or fitness, stress management, and supplements. And I do find that is a very effective combination.
Mm-hmm. It seems like probably both of us would agree that all of those moving parts are important, but probably diet is the foundation, the biggest influencer. So if that being the case, what kind of diet do you generally use with your type 2 clients or your pre-diabetic clients?
Yeah, I'm so glad you mentioned that because, I've had clients, frankly, get really good results, which I'll share in a little bit, with minimal exercise. So
yeah, no, but that's a good point because, people may have injuries or limited mobility where they can't exercise. And does that mean that they're stuck with diabetes? There's nothing they can do if they can't exercise? So
absolutely, because if they've already, as we said, depending on where they're starting from, one client in particular, she already had a little bit of nerve damage, and also she was quite obese, so for her mobility wasn't limited, so that's a good point. Mm-hmm. So as far as the diet, most people, we've talked about this a lot, I think, but most people have been on the standard American diet, which is highly processed food and refined carbs, so that means there's a fair amount of, added and hidden sugar already. The average American consumes 150 pounds of sugar annually. So I like to implement.
So somebody's eating my share because I'm not a saint. I still eat small amounts of sugar. I'm not going to lie, but I don't eat 150 pounds of it a year.
Right. Well, and that's, often I start with my clients on what I call the low-hanging fruit. So I have them complete a very comprehensive intake form that gets at their dietary habits, everything from what are they drinking to what are they eating, and what often shows up that we just is a kind of a no-brainer almost, but is soda. Sodas including Coke and Pepsi, and still have a lot of sugar. I think it's equivalent to, or just as addicting. What people don't realize is sugar can be just as addicting as cocaine. So with that, we usually start there. Now, some people are on diet soda, but they don't realize that aspartame has been linked to cancer in rats and has, not to mention, there's no nutritional value in these sodas. So we will often start there as a way to start limiting the amount of sugar that they're taking in. A lot of people, enjoy, and I enjoy Starbucks occasionally myself. But if you're having the mocha, vanilla, frappe or a latte with, there's just, you can just taste, it's so sweet,
Exactly.
And I used to.
I go to Starbucks, but I just get coffee, and I do use stevia in it, but, you don't have to say goodbye to Starbucks, you just have to change what you order.
Exactly. And occasionally I will get, I will get a tea. I will get like a chai tea. And even that I think is a little too sweet. But having that once a week is no big deal. And as you said, having, plain coffee or, something like that is fine. And there are alternatives to coffee like Dandy Blend, which I like because I still like a warm drink in the morning. But you can use Dandy Blend just in your coffee maker, and you can add, what I've done is like 1/4 maybe coffee and the rest Dandy Blend, or you can just go to Dandy Blend. And then what I tell my clients is you control what you put in there. If you want to use a little bit of whole milk, full fat milk, like from the farmer's market, you can do that, but you control how much sugar goes in there. And I think the other point I want to make about sugar is whether it's natural or not, it's still sugar. So the guidelines, I think, put out by the American Heart Association are 6 teaspoons, no more than that, daily for women and 9 for men. So I kind of keep that number in my mind because it's easy to get mindless and just start kind of, even though it's organic coconut sugar, a teaspoon is a teaspoon. You can just sort of mindlessly start.
Sugar is sugar, and it's, organic, non-GMO. It's still sugar, so that doesn't have anything to do with having less of an effect on somebody's blood glucose.
Exactly. So, or honey is another example. It's natural,
right,
but it's still sugar. So I do encourage my clients to move away from the processed food and a lot of the sweet, the added sugars, and then, focus on a lot of fresh vegetables and fruit and eliminate those that are more high glycemic, such as papaya or pineapple, dates, which are, the dried fruit in general are just much higher in sugar than the whole fruit. And then really as far as, vegetables, the only one that is just really high glycemic in that category is white potatoes. And the nice thing is, in the paleo world and ancestral diets in general is there are swaps for things. So, sweet potato is a good swap for a white potato. Yams are fine, the whole squash family is fine. So there's a lot of choices within sort of the medium to low glycemic range.
Right.
And then, as we know, you can add a little bit of butter or ghee or oil, and that will also help healthy fat will help slow the release of glucose in your system.
It sounds like you start kind of, not slowly, but you ease people into this. They're still eating maybe some carbohydrate foods and some fruit. Is there a point at which you do have to help people get to like a very low carb diet if their blood sugar still isn't improving, where they, maybe they can't eat any fruit, or they really have to restrict even the wholesome carbohydrates?
Yeah, that's a really good point. I have found in general that I teach my clients about healthy carbs, healthy fats, healthy protein. So that's one of the distinctions I like to make. And so what I have found is that they can also, in terms of phases, we can start with what I call more of a modified paleo. So they can have, and you're familiar with it, it's also called the blood sugar control diet. I find for most people, because they're coming off such highly processed food and a lot of sugar, that to do it a little bit incrementally makes sense. Weaning them off. Also, people can't handle making a ton of lifestyle changes or changes to their diet all at once. It can be overwhelming. So,
very true.
So I also have them keep a food journal, and we go over it every week, and we just start making more tweaks as we go along. So eliminating, another area would be junk food and eating out. Some people in a pinch still go to McDonald's, or today I had a client who went to Five Guys, and that's another area, where you're not going to get the quality of the food. You're certainly usually not going to get grass-fed meat, which has good omega-3. So we also look at fats, healthy fats as well. But sourcing your food is very important. And I don't expect everyone to go to the farmer's market, but buying organic, and also just avoiding things with pesticides and toxins, and whole foods, not necessarily the store whole foods, because it is called whole paycheck for a reason. But the idea is to buy organic. And the good news is even places like Wegmans and Harris Teeter they even have now more of a pastured, grass-fed meat section or options than they used to. So I think almost every major chain now definitely offers organic vegetables and fruit, as well as some grass-fed meat and wild-caught fish, usually options.
Yeah, I mean, and some of that stuff really isn't as pricey as some people might think it is. Some of it's really only a couple of cents more per pound or per, ounce or whatever as the conventional stuff. But I do, I kind of want to, I'm always like the devil's advocate on your show. I feel bad, but I want people to know, too, that if they can't afford all of the very, very best stuff, they can still get a lot of mileage out of a modified paleo-type diet by just getting, conventional meat, conventional fish or vegetables. It's, if you can afford the grass-fed and organic, that's great, do it. But for those who can't, this diet can absolutely still work. The most important thing is to avoid the obvious junk. The really refined sugars, refined grains, highly processed fats. So you can do this on a budget. You can do it if all you can afford is what's on sale at your regular store. Don't feel bad. Don't be ashamed of that. Just eat real food, like Christine was saying, whole foods, whole, unprocessed, unrefined foods. You will get very far just doing that.
Right, and I even buy my fish, at Trader Joe's. I don't, I'm on a budget myself, so I always tell my clients, look, you can go to Whole Foods and you'll still be, bombarded with farm-raised fish. So, you can get wild-caught fish at Trader Joe's. It's important to read labels. That's another thing we talk about, and avoiding hydrogenated oils and things like that. But you're absolutely right. I don't... in the beginning, frankly, when I got on, was on the blood sugar control diet myself, I didn't go to the farmer's market. That came later for me. So I think you're absolutely right. And also we talk about, good, better, and best. And that you do the best you can within your budget. For me personally, and I suspect you have, Amy, and maybe this goes with the territory of being a nutritionist, but food is one of my bigger line items in my budget. And I enjoy the experience of going to the farmer's market, but most of my clients, frankly, don't go. So I try to give people a range of options.
Right.
The other thing I just wanted to highlight was, this idea, going back just to finish up on that thought about phases. So phase one might be eliminating or going gluten-free with some grains, limiting the amount of grains, legumes, and dairies you have. So yogurt would be okay, a cup of yogurt, maybe a cup of legumes, or a cup of, gluten-free, good gluten-free grain like quinoa. But on phase two, we would eliminate that for up to a month. And often, it takes a couple weeks for people to implement it. And I find that after a few weeks, often, it does vary by person, but often that's, especially on phase two, when we start to really see results with their blood sugar starting to come down. So everybody...
that makes sense, and I think there's people who would either be intimidated by or not be able to implement at all a huge change to their diet overnight. Like all of a sudden you're going to take away everything that they normally eat on a daily basis. I think the phases is a really good way to ease people into it, and they can make the transition much more easily.
Yeah, absolutely. I think some people would just balk at the idea of going completely, which phase two is pretty much paleo. And let's briefly just talk about alcohol because that comes up, and I don't insist that people get off alcohol completely. And I find that, again, I myself, and I think you do too, enjoy a glass of wine. And it's not, there are less sugary, there is some sugar in alcohol, but I even did an article on this for the Washington Post on the less sugar, the range of sugar in wines, and it's kind of intuitive. The dry wines have less sugar in them. So,
right. And the funny thing is about hard alcohol, things, distilled spirits like rum, vodka, whiskey, that kind of thing, that stuff is actually almost devoid of carbohydrate altogether. It's so distilled and so refined that there's almost no carbohydrate in it. I'm not encouraging people to drink it, but the problem usually with that stuff is not that alcohol itself. It's the stuff we add it to. It's the orange juice and the cranberry juice and the soda and the sugary mixers. And if you just have a glass of something on the rocks,
exactly.
I'm not saying everyone should do that or needs to do that, but it's funny that it's not the alcohol as much as it is what we add it to. And also, when you start to have alcohol, what happens? Maybe your inhibitions are down a little bit, and that's when you say, oh, you know what, those nachos look good. I'll try that. Oh, let me have some of those French fries.
Right, or that dessert.
If you maybe start to eat things that you wouldn't normally eat if you're a little bit intoxicated.
No, I think that's absolutely true. And I was thinking one of my clients, she likes her whiskey on the rocks, a little, small glass, couple times a week, and as you pointed out, it's very non-caloric, and I didn't have any problem with that. And there's also ways, having smaller little sort of tips or tricks you can do. I happen to have a set of wine glasses and little vodka shot glasses that I inherited from my parents. And so rather than have a full glass of wine, you can have a smaller, it's like portion control, same idea. You can kind of, have a quarter of a glass and use a smaller glass and still feel like you've enjoyed it. And you can just spread that out.
It is. Being on a reduced carbohydrate diet actually changes people's alcohol tolerance. It kind of hits you harder and faster than when your body's full of carbohydrate. So you're at state. You don't need as much to maybe get the effect you're looking for. If you're looking for a little bit of relaxation or something to take the edge off, you can probably feel that with a lot less alcohol than you would need otherwise.
Yeah, absolutely. And then there's resveratrol, an antioxidant in red wine. So some people just choose red wine for that reason. I like red wine myself, but I like occasional in the summer, occasional white wine. But I think the trick is really moderation there.
Yeah, definitely. It's not. That shouldn't be the basis of anyone's diet.
Right. And I always joke that don't start drinking wine just for the health benefits of the resveratrol or the antioxidants.
Yeah, that's probably not the best reason to start drinking. So we did mention, this resveratrol. You mentioned omega-3 earlier. Are there specific supplements and nutrients maybe that can help control blood sugar?
Right. So I'll start with chromium and then work up to berberine. Chromium, we talked about, is involved in blood sugar regulation. It's also called the glucose tolerance factor. And adequate chromium levels may also help with insulin sensitivity. So chromium is a mineral that you can find in some foods, such as red onions, brewer's yeast, liver, and oysters. And also certain spices can act as an insulin substitute, such as cinnamon, by increasing the uptake of glucose. So I add cinnamon pretty regularly as a spice to my foods. And, cinnamon sticks. There's a great bison butternut squash chili recipe that calls for cinnamon sticks. Yeah, it's one of my favorite paleo recipes. And then also chromium is in certain supplements that I do use. So initially, when my clients are transitioning with their diet, I typically will use like a supplement that I think you're familiar with too, Amy, called Glucobalance, because that has a pretty high dose. It has 100 milligrams of chromium in the supplement. So I think that one's a good one, along with, a lot of minerals and vitamins such as magnesium. And then berberine, it's a Chinese herb. The Chinese have been on to this much longer than we have in the West, but it has made some inroads here. Several studies, often published in Chinese journals, have compared it to metformin, and the profile is very favorable, but there are also some additional benefits, such as reducing cholesterol and also even a modest weight loss. So I use berberine, that combination often of berberine and glucobalance.
Yeah, I've actually heard berberine referred to as herbal metformin.
Yes, exactly. And, some people don't do well on metformin because of the side effects, the GI side effects. Mm-hmm. And so berberine is a good alternative to that. If someone is on metformin, though, and they're doing well, I don't necessarily add berberine to it because it could be just too much.
Right.
But it also does work well in clients who just want to go the natural approach.
Supplements you specifically wanted to mention, but we heard about interactions between maybe some of these supplements and medications they might be taking.
Right. So I think part of a thorough intake should include any medications, any supplements they're already on, in addition to some of the foods that they eat. Because what I have found is that there can be a food supplement interaction, there can be a supplement medication interaction. So all those things are very important to understand, and a food medication interaction. So, for example, berberine can interact with blood pressure medication. So I have one client right now whose blood pressure is still high. It had come down, but then due to a variety of stressors in her life, it has gone up. And so we're working on getting it back down. But I told her, I said, I'm not going to order berberine for you until you feel it's come down enough that you can get off your blood pressure medication. So I will literally check any supplement against any medication they're on to see if there are any interactions at all. And if there are, I won't order it for them.
Mm-hmm.
Some other ones that can interfere or interact with medications, and these are not necessarily ones that I order from my clients specifically, but often clients, as you know, we're complex beings. They often have other comorbid conditions. So some of these might be considered. One is St. John's wort can interact with everything from, or reduces the effectiveness. So some of these things are kind of subtle in terms of the interaction, but that can reduce the effectiveness of other drugs, including birth control pills, drugs to prevent organ transplant rejection, some heart disease medications. Vitamin E, which is a good antioxidant, can counter free radical damage to the cells. But if you take it with a blood thinning medication such as Coumadin, that can increase the anti-clotting activity, which then therefore causes an increased risk of bleeding. Ginseng, which is another popular one, it's great for boosting the immune system, which can reduce colds, etc. And it can even lower blood sugar, but that can interfere also with the bleeding effects of Coumadin. And then it can enhance bleeding effects of aspirin, nonsteroidals, anti-inflammatory drugs such as ibuprofen, which is over the counter. So in addition to looking at medications, you really have to look at what over-the-counter drugs people might be taking. So those are just some examples of that.
Yeah, definitely not easy to manage, especially when people, like you said, have these complex cases on multiple different compounds that all kind of interact. And it's typically, I hate to say this, but within the conventional medical community, usually nobody's minding the store. There's not one physician who's looking at the whole picture and looking at how these things interact. Somebody will go to a cardiologist and then an endocrinologist and the PCP, and each of these doctors has their own program and protocol, and nobody's really monitoring the total situation to see if some of these drugs are appropriate to be on together.
Now that's really an excellent point.
It's not the case of every doctor, but I I saw that with my own mother, that she was what I would call a victim of polypharmacy, being on many, many different drugs that she probably should not have been on at the same time.
No, that's an excellent point, and I think an advantage of having a primary care physician is that that is one of their roles, is to serve as a central coordinating point or person for all these other specialists and so on. And so I do encourage my clients to see a primary care physician if they're not already. Most of them already have seen a primary care physician. Sometimes it is their primary care physicians who are referring to me. But for that very reason, and I have a client right now who has seen a food allergist, which I recommended, and then he's referred her to a gastroenterologist for an endoscopy, and that's also, I think, appropriate. But then I realized I'm becoming the kind of coordinating person here.
Right.
And she has some symptoms that are outside of that I think also even potentially she may need to see a cardiologist. And so I kind of steered her back to her primary care doc a little, just to let her know, and update her as to all these different specialists. But also, make sure she's aware of the cardio problem that she's having since she's been seen, because all her exam and lab tests showed normal results.
Okay.
So she was probably not even aware of this happening. So it's very easy to get caught up in that, and it becomes kind of a web of information. And but as a health practitioner and a nutritionist myself, I do try very hard. I keep track of everything and keep up to date on what's going on.
Right.
And I think, we have a duty to be careful.
Definitely. So shifting gears back to something we talked about earlier, we talked about kind of connections between obesity and type 2 diabetes, and I have my own thoughts on this, so I'm curious to hear what you think. Is there a connection between obesity and type 2?
Well, there is. We know that obesity does not necessarily mean you're going to get type 2 diabetes, but it is considered a risk factor for both pre-diabetes and type 2 diabetes. So if you have pre-diabetes, the good news is that the Centers for Disease Control and Prevention, which has studied this condition quite a bit, and as we know, obesity is a public health problem, as well as diabetes. There are at least between the 60 million people estimated with prediabetes and 30 with type 2, that's nearly 100 million people. So both of these are public health problems. But anyway, so the CDC research shows that losing just 10% of your body weight reduces the risk of having type 2 diabetes by half, or 50%, which is pretty significant. So I do encourage my clients, especially if they're, most of them are overweight. Now, there are exceptions to that. That doesn't mean every person with type 2 is overweight, because I've seen a few thin clients or normal range weight clients. And Frank, they feel often they're ignored in this whole discussion. So I want to be sensitive to that and acknowledge that right now and say, not everyone with type 2 or prediabetes is overweight. Having said that, the majority of them are. And so it is important, especially knowing, that you can reduce your risk by so much, to get moving. And there's so many benefits to exercise anyway, but especially if it's important. It's another important tool to use to reduce your blood sugar numbers. And so exercise is important to controlling diabetes. And the CDC has also studied the optimal amount of exercise and frequency. So they recommend exercising moderately 3 times a week for at least 50 minutes, or, it could be 5 times a week for 30 minutes. So finding, obviously what works for you, your schedule, what you can fit in. And I take an incremental approach. many clients aren't exercising. So, we start out with what can you do? Do you have access to a gym? What do you like to do? I think that's actually the more important question, because a lot of people start out and then they quit. How many people have had a gym membership and never used it? So.
Right. Oh, that never happens. What are you talking about?
So I think it's more important to just walk. If you can spare, even 15 minutes, get out on your lunch break or after you get home from work, and just walk around your neighborhood. And that's often what my clients do. We just start out simple, just walk, and then.
No, I couldn't agree more. I mean, it's the best exercise is the one that you will do. Like you said, whether that's walking or maybe you do have the mobility and the wherewithal to run or to do something intense. I know, Christine, you play tennis. And there may come a time, and there are some people who need to do something more intense. Walking may not be enough for everybody, but especially for the people that are starting from a place of being completely sedentary, I mean, just moving at all is a great start. You were saying earlier that you like to use the word movement instead of exercise, or we can call it physical activity, and that kind of helps us remember that it's important to just be active during the day. So maybe it's such a cliche, but really, taking the stairs at your office instead of the elevator or escalator, parking when you go to the mall, don't automatically look for the closest spot, deliberately park far away. Definitely, if you take the bus or the train to work, maybe get off a stop or two early and walk the rest of the way. So there's a lot of ways to be more active during the day.
Absolutely. One of my clients today was just saying that on her lunch break, she goes to Whole Foods, which is a mile from her office.
Wow.
And so she just incorporates, the more you can incorporate that into your routine, the better and easier it is.
Right. And it's at least I find anyway, exercise is really good for mental health. Some days I have a bad day and I don't feel good even after exercising, but most of the time if I exercise and I get my heart rate up, I tend to just feel better, physically and mentally. I feel more optimistic. I feel a little bit recharged. I have a more positive outlook. So a lot of people exercise for stress management. That's kind of how they take their frustration out or just makes them feel better. What is the role of stress management in diabetes and blood sugar control?
Yes, and I think that's a very important point, and it relates somewhat to what we were just talking about, because often my clients are already under a lot of stress. Their adrenal glands are stressed. They are releasing adrenaline and cortisol, which have an impact on your blood sugar, and insulin's ability to regulate your blood sugar is often damaged by that. So I often recommend kind of low impact movement, and that can range from swimming even to, and I don't mean necessarily, breaking out and doing, a lot of laps, but just something like the breaststroke even, swimming, but also yoga. Yoga and meditation are two of my favorites because they involve deep breathing. And as we learned, Amy, when you digest food, it's important to be in the parasympathetic mode. So one way to think about it is to take like 5 really deep breaths. And they found that deep breathing from your abdomen, as opposed to just kind of more shallow breathing from your chest or diaphragm, is more beneficial. And then really exhaling. I had a yoga instructor on the show recently, and she said most people are holding their breath. They're not even fully, and they're not aware that they're doing it. And they don't even fully release their breath. So I like to start the day with some deep breaths. It also helps with my circulation. I'm somebody who kind of wakes up stiff in the morning, but also before you eat, you can take some deep breaths. It's something, it's free, doesn't cost anything, it's easy. So just practicing deep breathing, which is foundational to yoga, it's foundational to meditation. And then if you have time to to take a yoga class. The nice thing with yoga classes are you can just drop in, you can pay as you go, you don't have to commit to an entire class. Some employers now offer yoga classes. Meditation is catching on more and more, and I've done other podcasts, even with Buddhist monks, to talk about all the health benefits of meditation, which definitely can help you with your blood pressure as well. I've seen my own blood pressure drop over 20 points, and it stayed that way.
Significant.
Yes, it stayed that way through meditation and doing what we call calm abiding meditation or shamatha. But they're all different, visualization is another way. And I just want to emphasize sleep, because sleep is so important. It's important for your cortisol levels as well. There's so many implications of sleep for your health, including weight gain. And I'll share some blog posts in the resource section of the show notes with the listeners, but getting a good night's sleep, both quantity and quality, really matters, so you get into that REM or REM sleep, and maintaining kind of as normal circadian rhythms as you can, which is harder for shift workers, but it's really important for your energy as well to get a good night's sleep. So that is another important.
I've seen some studies that actually show that even a single night of insufficient sleep will make you sort of temporarily insulin resistant. Or, I shouldn't really say that because that will scare people. It changes your glucose tolerance the following day. So, and regardless of what you eat, it would be best to stay low carb that day than if you're not sleeping well, but just the hormonal environment of the body is so influenced by proper quality and quantity of sleep that when you don't get it, it can change your insulin and glucose dynamics regardless of what you eat. So that's definitely a huge factor. And with the stress management, I wanted to say that if people don't believe it or don't appreciate how much this can affect you, for those listeners that may have a blood glucose monitor at home or a meter, you can test when you wake up, take your normal fasting blood sugar, and then if you have a stressful commute, go your commute, and maybe as soon as you park your car at your destination, or just pull over to the side of the road when you can do so safely, and test your blood sugar, and you will see that it has probably gone up significantly, and that's not due to anything you ate, assuming you're not eating in the car. It's not due to anything else. It's due solely to the stress.
Mm-hmm.
You can see, and granted, that's an acute thing. That doesn't happen all day long, but it can if you're one of those highly stressed people that just feel on edge all day long. But that's a good way to kind of show yourself what that kind of mental environment is doing to you. Because if you have a stressful commute, it's really only what we perceive as stressful, right? You could get really angry, you could get frustrated, or you could listen to Christine's podcast and be calm in the car. So it's not so much the situation itself as how we react to it that controls what goes on.
Mm-hmm. Well, I'm glad you're bringing up testing and home testing, because one of the things that I do require my clients to do is buy a home glucometer. And I have a chart they have to they complete, which is includes the food journal and exercise or fitness or physical activity and stress management. But usually we just do at least 3 to 4 days of that, and it's very helpful because they can track the immediate impact of not only their diet but any fitness or stress management activities on their blood sugar readings. So ideally you take your blood sugar readings 4 times a day, and I give them guidelines around that, but I think, and then their supplements as well, they track that. So it is important to monitor your blood sugar, but it's a very educational tool. And so if someone binges a bit or goes off and has a big dessert, they can see the impact right there, and I don't even have to say anything because the numbers speak for themselves.
Right. So you've been doing this for a while. You've been coaching people with with diabetes. Do you have some good case studies that you want to tell us about?
Yes, I'd like to share two stories, and I've changed the names of my clients. So the first one is an African American male. He was 39 years old, and we'll call him Tom. And he was referred by his primary care doc, and he was recently diagnosed with type 2. And he's an example of where it did run in his family, and he was very concerned about that, especially he was unaware, frankly, of the medical complications, but we did just briefly talk about that, and he was very serious about making lifestyle changes. So I do have a question on my intake form about basically how motivated are you on a scale of 1 to 10. And
right, I think I recently added something like that to my own forms. I think that's a great idea to have.
And the good news is most of my clients who've been, if not all of them, diagnosed recently are usually at least an 8 or 9. I just realized I don't have a 10 yet.
Well, I give people credit for being honest, because I filled out a similar form for someone else for my own health care recently, and I think I circled an 8, because 10 is, you're all in, you're going to do whatever it takes all the time, every day, you're never going to slip up, and I don't think anyone, myself included, is prepared to commit to that. That's just human nature.
I think you're right. It's often 2 steps forward, 1 step back sometimes. And what I like about this story is it illustrates some of the complexity of looking at, and discovering. We kind of play detective sometimes. So, while he had a diagnosis of type 2 diabetes, there were some other things at play. So we started on a modified paleo and then switched over to the paleo approach. And he saw his blood sugar drop an entire point. So he came to me, and we worked together for 10 weeks. And I wanted to say that it does take a few weeks usually for them to get, the template, as they call it, down. And so he was also starting to lose some weight. He needed to drop about 30 pounds. And he found that he lost about 15, which was great, but he wasn't really finding the energy to exercise. So most of my clients work full-time. They're professionals, and so was Tom. And he just found that he was really tired at night, and we started exploring that. Well, it turned out he had a diagnosis of sleep apnea. And what he said was, my blood sugar levels have dropped from 7.2 to 6.2, and I saw a dramatic improvement in my overall health. And so he was able to get into the pre-diabetic range. And then his cholesterol, this is another significant point. When he came to me, his triglycerides were off the charts. They were 500.
Wow. Oh my gosh.
Yeah, so of course I was keeping an eye on that. And we were able to cut that in half. So he went back to his primary care doc, and when he was last tested, it was 250. So that was,
which is still very high, but like you said, fully half.
Right.
Making progress.
Exactly, and I could have continued, working with him longer, but he felt, as he says, I have the template down. The other quick story, one of my really a little more dramatic client in terms of the short period of time that she was able to see results. She came to me. She was, and I love her dearly, because it's rare to have a client who just said, no, I'm going completely natural, completely alternative. So she found me actually through my website. She was searching for alternative medicine. Now, unfortunately, she waited a year after she was diagnosed with type 2, and she was experiencing a little bit of neuropathy in her feet. I think that has improved with the combination of things we've been doing, but her blood sugar level dropped from 8.5 on her A1C to 5.9 in 12 weeks, and it has since dropped to 5.5. So she's been solidly in the normal range. And she had lost 25 pounds. Yeah, so that's what I just want to emphasize again. It can be reversed. Sometimes the weight loss does take longer, as you and Amy and I, we've talked about.
Yeah, I'm glad you said though that you know, somebody was feeling better and having great health improvements, but the weight loss took a little bit longer because this is fairly well known. I mean, there's studies in the medical literature that the benefits of low carbohydrate diets happen even in the absence of weight loss. So even if, because like we said, there's plenty of quote unquote normal weight individuals that have type 2 diabetes or insulin resistance, and by cutting back on carbohydrates, even if their weight doesn't change because they were already at a normal weight, their triglycerides will drop, their blood pressure will drop, like you said, their insulin and glucose will drop, some of these other inflammatory markers will come down, and that's just the beauty of eating this way, is that of course people may have a goal of weight loss, but even before the weight starts budging, your body's already starting to become healthier, and it's almost like the weight loss comes as a side effect of your body just working better metabolically, rather than the weight loss is causing you to get healthier. It's the other way around.
Yeah, absolutely.
All right, well, unless there's anything else you want to share, I think we can wrap this one up. Are you seeing new clients now? And if so, where can people find you?
Yes, I am accepting new clients, and people can reach me through my contact form on my website. Again, that's reversediabetescoach.com. They can email me at Christine@reversediabetescoach.com, and they can call me at 571-357-2726.
All right. Well, that's very, very nice of you. It's not often that practitioners give their number on the podcast, but just goes to show how much you want to help people. Well, thank you for letting me be a part of the show. I love to get the word out and just learn new things from your research and bounce ideas off each other. So everyone out there, thank you for listening. And until next time, be well and go eat something good.
Thank you, Amy.